We're back with Dr. Salisbury and Dr. Faulkner once again. This time we are posing some questions to you guys from our viewers, and so I'll just start firing them off. We'll start with you, Dr. Salisbury. When dealing with men's health, does the high cost of prescription drugs and doctor's visits dissuade some men from being helped?
Certainly, Bobby. I mean, you look at someone who's, let's start with someone who doesn't have insurance. Those people are more inclined not to come see a physician because of financial issues. So if an office visit is, say, $150 and the prescription is, say, $75, then you're always upwards of $300 some already, and some of these people don't have those resources. So that in and of itself will prevent people from going. Let's say someone who has insurance, the deductible may be $50 to come see us, but then the medication might be $150. So again, that's that continuous triad that, you know, hey, even people with insurance sometimes don't come to the doctor. Exactly.
Okay. So, I actually want to pitch this to both of you guys. With all the talk of Obamacare right now and it being repealed potentially by the new Trump administration, how does that impact your guys' clients? Do you think that that could cause problems? Do you think I'm curious to get your thoughts on that.
It's interesting. You know, we've seen some impact from the state level with the Affordable Health Care Act and patient access to care. I think it addressed two needs. One was the patients who were uninsured, and then the underinsured patients who really are impacting us directly. That we see in high rise costs of premiums, even within our own practice as well. And then deductibles are rising. We don't know if this is insurance company or the Affordable Health Care Act.
Boy, it seems like it's gotten out of control, doesn't
it? It really is a pendulum that's swinging far. Quickly,
15 seconds, your thoughts on that.
Well, I mean, Dr. Faulkner hit it on the head, but right now, currently, about 11 million people in the United States on Obamacare. But we don't know what's going to happen going forward. That would be a huge disservice, and people will be impacted greatly if that goes away.
All right, some doctors have begun recommending a 4K score test over PSA. Explain that and what your thoughts are.
It's just a newer screening model that was fashioned in Sloan Kettering.
Is that blood or
it's blood, it's a blood test. And, you know, currently PSA, the standard PSA is the routine screening. 4K, you have to understand that there are probably some increased costs that go along with the test. So as a screening model, probably not as advantageous for the patients. But if you've had patients who may have an abnormality in their PSA or a patient that you biopsy several times without a diagnosis, it may have a role in the treatment paradigm.
Quickly, I want to get from both of you any exciting experimental research you see that's a game changer on the cancer front, either prostate or colon or elsewhere?
As a primary care physician, that's not really my field, so I don't really have really insight into that.
All right, we'll toss it over to the prostate expert. You know, what about prostate cancer?
Prostate, there have been wonderful new medicines that have been on the rise and that we have access for our patients. Another thing we talk about is prevention. I think there's a lot of data that's looking at chemo prevention for prostate cancer, some natural herbal things. So there are things that a patient can do on a daily basis to lower their risk besides diet.
All right. Well, thank you so much for coming in and enlightening the audience this morning. Lots of questions. Everybody always has questions about medical coverage and medical questions. They go online, WebMD, before they end up going to the doctor for the exact reason you talked about, because it's so darn expensive these days. But see a doctor if you need it, please. We'd love for you to join the conversation. Or if you have a topic that you'd like to see us cover, let us know. Send us an email to publicaffairs@cbs46.com. And be sure to like our Public Affairs on Peach Facebook page. There we talk about our upcoming episodes and get your feedback. That is going to do it for this week's edition of Public Affairs on Peach. We'll see you right back here next Saturday morning. Have a great weekend.